So good morning and welcome to our weekly briefing. As usual, we'll start off with an update to the numbers. First, since last week, 1,051 more Philadelphians have been diagnosed with COVID. As of yesterday, we're seeing an average of 206 new cases per day. These are both really good numbers that we've been waiting on for a while. Remember, when we talk about good numbers and bad numbers, we're really talking about trends. And the trend over the last week is encouraging. The last time we reported an average daily case count this low was in the middle of August. We were only doing about 3,000 tests per day back then. Now we're consistently over 7,000 tests per day. And the percentage of tests that are coming back positive is much lower. In mid-August, it was over 7%, while for the past week, we've been at about 2%. Things are trending in the right direction, but we're not past COVID. Although things are getting better with our high vaccine rates and because Philadelphians are doing a good job in general at keeping masks on in indoor public places. On Monday, we reported that more than 2.1 million doses of COVID vaccine have been administered in Philadelphia. More than 5,000 Philadelphians got their first dose. More than 4,000 became fully vaccinated just in the last week. So 87.1% of adults and 80.7% of those 12 and over have had at least one shot. 71.2% of adults and 66% of those 12 and over are now fully vaccinated. Last week, the CDC recommended that certain people are now eligible to get boosters. First, everyone who got a Johnson & Johnson vaccine at least 2 months ago is recommended to get a booster dose. There's some evidence that giving a booster dose of Moderna or Pfizer to people who received Johnson & Johnson might be more protective than a second dose of J&J. And people who are older than 65, who live in nursing homes, or are older than 50 with certain high-risk conditions should get a booster 6 months after their second dose of Pfizer or Moderna. The CDC also recommended that people younger than 50 with certain high-risk conditions, including pregnancy, and those in higher risk occupations consider getting a booster dose. Last week, we administered 10,000 new boosters, meaning that nearly 42,000 people in Philadelphia have already received their boosters. We expect that number to continue to grow quickly now that more people are eligible. Today, I'm happy to present for the first time the actual vaccine coverage percentages for city employees. Before we get into those numbers, I want to thank everyone who works for the city who has gotten vaccinated. You're doing your part and helping to keep our neighbors, friends, and families safe. We compiled these data by comparing the records folks have submitted to the city's HR system with other vaccine records we have. It's important to note that these numbers are the minimums. If city employees got vaccinated outside of Philadelphia, we don't know about it. And we still want employees to submit their vaccine records. But in the meantime, this gives us a more accurate picture of how we're doing. Overall, 65.4% of Philadelphia employees are fully vaccinated as of yesterday, which is very similar to our overall vaccine rate. We're working now to get vaccine coverage ranges for each of the city's biggest departments and plan to publish them tomorrow. Last Friday, the latest of our vaccine mandates went into force. Today, every healthcare worker and student and staff at colleges and universities should be vaccinated or have an approved exemption. To ensure that this is happening, we're working to survey healthcare facilities and colleges and universities in the city. Because of the high level of risk in nursing homes, we're surveying them first. The data hasn't been completely collected or analyzed yet, but we have some initial data from the federal government. As of Sunday, for sites that have reported, more than 94% of nursing home staff in Philadelphia have received at least one dose of COVID vaccine. I couldn't be more pleased by those facilities and staff that stepped up and did what was right and safe. We'll be working with those facilities that don't yet have 100% coverage to ensure that staff with exemptions are completing the required testing twice per week and that all staff are either vaccinated or have approved exemptions. Finally, I'd like to address a potentially disastrous situation unfolding in our region. There is a critical blood shortage here in Philadelphia. Because of COVID, places that normally hold blood drives haven't been holding them. And because of COVID, people who normally donate blood haven't been donating. That's very dangerous for people who are undergoing surgery or who experience trauma and may need a potentially life-saving transfusion, meaning any of us. I want to make a very serious request to you today. Please donate blood. It's quick, it's almost completely painless, and it will save lives. To wrap up, if you'd like more information about the pandemic and the city's response, you can visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488.